Auricular Therapy, a Practical Guide by Michael Vihila, licensed acupuncturist and licensed massage therapist. Module 2, A Brief History. In the beginning, auricular therapy was practiced in China and has its roots in Chinese medicine, but also had limited use in other cultures. But there was no map in the early systems, and as you'll see, there's an extensive map now. And it was discussed in the Yellow Emperor's Classic of Internal Medicine, but again in a very limited way, with a few points being used for empirical purposes. In the Chinese literature, they talk about the meridians, and all 6 yang meridians do connect directly to the ear. All 6 yin meridians connect indirectly to the ear, and the ear was used in diagnosis and prognosis in early Chinese medicine. And just to review some basic concepts of Chinese medicine, yin and yang are the complementary opposite qualities, like heat and cold, light and dark. And in Chinese philosophy, health depends on a dynamic balance of these elements. Homeostasis is the Western medical equivalent. So we do have that concept. It's just couched in much more technical medical terms for us today. So often people ask about piercings in the ear, but the gold earrings worn by sailors were said to improve their vision. As you learn about auricular therapy, you'll see that the point in the center of the lobe is the eye point. And even King Tut, you'll see, has that piercing in the center of the lobe for the eye point to improve vision. But outside of China, Hippocrates bled points behind the ear for impotence and sciatic pain. In Persia and Europe in the Middle Ages, there are medical texts that report the cauterization of the ear for sciatic pain. Sciatic pain seems to be one of the themes that was discovered many years ago, that there was a point in the ear that treated that effectively. But then in the 1950s, Dr. Paul Noget of France developed what was called a somatotopic map of the ear as a reflex system. And Dr. Noget had a patient who came into his office, and this red point in the picture there is the sciatic point, and there was a scar on the lady's ear, and he said, "What happened there?" And she said, "Well, my ear was cauterized by Madame Barine, and it got rid of my sciatic pain." Now, Dr. Noget considered that it might not just be an empirical point, but possibly an anatomical point, because he was an osteopath and knew that sciatic pain could come from dysfunction of L4 and L5. He was also a neurologist and an acupuncturist. So I thought, well, if that's L4 and L5, where's everything else? So in his research, he developed what was called the inverted fetus model, and that was just a mnemonic really to help see the total picture of how the ear projected the structures of the body onto the ear. It was just a summary of that. Then a few years later, the Chinese government got wind of Dr. Noget's research, and in 1958 they enlisted the Nanjing Army to do research and to look at the various health complaints that the soldiers had and see what was responding on the ear or what was reflected on the ear. And they developed what they would call a functional model, meaning when a person has this kind of pain or symptom, it shows up here in the ear. So they also accidentally discovered an addiction cure, which then an American doctor took to another level. And that American doctor was Dr. Michael Smith. In 1973, he developed a protocol for withdrawal from substance abuse. And as beautiful as that opium poppy is there, it does cause a lot of problems for people. And he formed what was called NADA, the National Acupuncture Detox Association. So they have a training that trains mostly drug counselors to work with people with addictions using 4 or 5 very specific auricular points to help with the withdrawal process. To give you some sense of how well known auricular therapy is, in 1990, the Director General of the World Health Organization proclaimed to an international gathering that auricular acupuncture is probably the most developed and best documented scientifically of all the microsystems of acupuncture and is the most practical and widely used. So while many people in America are not familiar with this, it's widely practiced in Europe and certainly in France, where Dr. Noget developed it. And even in America, in 2001, a doctor who had some knowledge of this auricular system developed something called AcuBeads. And it was kind of a shotgun approach to placing pellets in the basic regions for neck pain, weight loss, low back pain, and headaches. Now, they're not nearly as specific as what a good auricular therapist would be doing when they palpate or find points electrically and treat what's specific for this individual person, but as a general shotgun approach, they can be quite effective. So that's a very brief history of auricular therapy so that you get some sense that it has been around and is being used widely across the world. Every acupuncturist learns it in school. And if you want to learn more about the history, there are many textbooks that go into a lot of detail. My intention here was just to give you a very brief overview. And next we will look at the anatomy of the ear.